Despite various PAP promises to make healthcare great again in the recent years, medical costs are rising much faster than our economic growth. In 2014, Straits Times reported that 25% of those who rejected dialysis treatment for kidney failure was due to financial reasons. The most recent case that captured the attention of the nation was the case where Medishield Life paid just $450 of the $4,477 post-subsidy bill. These are the true stories that Singaporeans are experiencing with our current healthcare system. In 2017, our non-profit National Healthcare Group made a profit of $68 million, while SingHealth is at a more modest $8 million.
Unfortunately, in the 1980s, healthcare became viewed not so much as essential, but as a commodity, as something that had to be traded and something which could be seen as an industry for profit. So what is the effect of having this privatized, very commercialized healthcare? One of the major effects has been a rise in inequality. Now, inequality is something that people talk about. And we know people say, oh, you're talking about the politics of envy. Everybody wants to drive a Maserati or Ferrari and live in a bungalow. But we're not talking about luxuries here. What we're talking about here is life and death. In Singapore, the outcome in terms of life, death, complications of illness is a function of your socioeconomic status, which it should not be. So basically the idea is if you get sick, you should concentrate on getting better. You shouldn't worry about who's going to pay your bills, whether you're going to have to sell your house to pay your debts. And this is why I tell my patients, the priority, don't worry about the insurance, we'll settle that later, don't worry about that. Your goal is to get better so you can go back to your family, you can be a part of your life and your family life as a whole.
1. Scrap the 3M system of Medisave, Medifund, and Medishield, and return the Medisave money to our own CPF account.
The key element of this, though, is that it's a simple plan. There's only one system. There's no more Medisave, Medishield, CareShield, ElderShield, what do you call it? CHAS Blue, CHAS Orange. You really need a dictionary to try and understand the current healthcare schemes in Singapore. If you want to help people, don't put in this really complicated and bureaucratic scheme. Just have something simple and effective, like what we are proposing.
2. Establish in its place a single-payer system by setting up the National Health Investment Fund, where the government and the people contribute into.
The key feature of the SDP healthcare plan is a single-payer universal healthcare system with a government-managed central healthcare fund. So this fund will be run along the lines of a government-subsidized public insurance scheme, and it will finance compulsory basic health, accidents, pregnancy coverage for all citizens and for PRs who are here more than 6 months in the year.
3. Require Singaporeans to contribute an average of $50 a month, depending on your income level, into the NHIF.
Essentially, the contribution will average around $50 for the average Singaporean. For those who have no income, the contribution will be heavily subsidized. And this is very close to the Medisave and the Medishield Life premiums that we are paying right now.
Cover every Singaporean for basic healthcare, including accidents, pregnancies, through the NHIF.
So effectively, it cuts out a lot of bureaucracy, it cuts out a lot of the paperwork, and the hospitals now have hundreds, if not thousands, of administrative staff. In the old days, SGH used to have one matron, one supervisor. Okay, those days are over. Now they have hundreds of staff at multiple levels doing billing, doing administration, doing coding, doing all kinds of things. And it is just a bureaucracy that feeds on itself and adds incredibly to the cost of healthcare.
Introduce a single ward class which provides same treatment for all. Treatment is based on clinical need and not on ability to pay.
See, if you get sick, it should not mean that you have to worry about whether you're going to have to suspend your child's education or whether you're going to have to cut back on having dinner with your family or things like that. These things should not be the case in a civilized, high-income society. You can be certain that the SDP will not allow the government to treat the health of Singaporeans as a commodity for profit-making, but rather as a fundamental right to be preserved and protected. And we can do that even with a small number of members of parliament. We can raise questions, we can call for divisions, we can call for amendments. And it falls down to a question of values. Because we believe that healthcare is a basic human right. Okay? Nobody chooses to get sick. As we heard at the campaign launch, the SDP believes in people above profits. See? And that is what this healthcare plan is all about.